Thank you for joining our briefing session today for improved access to psychological services in residential aged care homes program. This briefing session is for the request for proposal for this program. But before we begin, I would just like to start us off by acknowledging the Ngunnawal people as the traditional custodians of the land on which we are joining this briefing session from today. And I'd also like to acknowledge the other people and families with connections to the lands of the ACT and the surrounding region. Like to acknowledge and thank our First Nations communities for their ongoing contributions to the life of Canberra and pay our respects to their elders past and present. And I'd also like to extend that respect to the traditional custodians of other lands that you may be attending this meeting from, as well as any Aboriginal and Torres Strait Islander people here today. We are here today to be talking about a mental health program. When talking about a mental health program, it's particularly important for us to be acknowledging the individual and collective experience of those with lived and living experience of mental ill health and suicide, and the experience of their carers, families, and supporters. We really value and respect the generous and vital contributions of people who share their unique perspectives to guide us to shape an effective and connected primary healthcare system that supports better outcomes for us all. We're just going to start off with a few introductions of the Capital Health Network team who are joining us here today. So my name is Stephanie Linton. I'm the Mental Health and Suicide Prevention Program Manager here at CHN. I'm actually standing in today for Hope McMahon, who is our Older Persons Health Planning Manager and who is the project manager for this particular program. Hope is currently on leave, so you will be stuck with me today, but I will do my best to do her justice and talk about the program as well. We will also endeavour to answer as many questions as we can with the rest of the team here today, but if we do need to take a few more on notice than usual, just to make sure that we are getting it right there as well. Thank you for your patience with that, and we will certainly do our best efforts there. Anais Legol, who is our General Manager for Health System Improvement, is not here today, but she is the sort of executive at CHN who is looking after our older persons program area. And I might just ask Mamta to introduce herself.
Thanks, Steph. And hi, everyone. So my name is Mamta. I'm the Senior Manager for the Health System Integration team here, working very closely with the rest of the CHN team. Thank you.
Thanks, Mamta. And Russ?
Thanks, Steph. Hello, everybody. I am Russ Trinidad, and I'm the Senior Manager for Primary Care Integration, also working closely with the Health System Integration team. Thank you.
Thanks, Russ. We also, another person currently on leave is Sharon Storen, who is our contracts coordinator, who looks after all things procurement for us here at CHN. So we do have Emma and Kunal in the background of this meeting as well, just helping us out with sort of monitoring the questions and managing some of the administrative and tech support as well. So if you see those other couple of names there, that's who those people are. All right, I'll just start with a little bit of an overview of today's session. So just to run through the plan of today, we've just done our introductions, just as a bit of housekeeping as well. When we get towards the end of the session, we will have some time to be responding to some questions from attendees for today's webinar. When you are asking questions, please make sure that you put them in the question and answer box and not in the chat box. This just helps us make sure that we are answering your questions and we can keep track of them there as well. So the process for today, I will begin just by providing a little bit of an introduction and overview of Capital Health Network for those who aren't familiar with us. And then we will be working through the request for proposal and talking a little bit about the program generally, the Improved Access to Psychological Services in Residential Aged Care Homes program. So we'll talk about the documents that might help with your application and the sort of process for responding to this request for proposal, as well as the timelines that we're looking at for this one. And then, as I mentioned at the end of this session, we will have some time to go through some questions as well. Please feel free to post questions in the Q&A box as you go as well. We won't get to them get to them until the end, but you're welcome to put them in whenever you think of them. Okay, so I'll just start with a bit of an overview of Capital Health Network. So Capital Health Network, or CHN, is the primary health network for the ACT. PHNs, many of you will be aware of PHNs. There are 31 of them across Australia that have been established by the Australian government in specific regions with the key objectives of increasing the efficiency and effectiveness of health services, particularly for people at risk of poor health outcomes, and improving the coordination of care to make sure that people are able to receive the right care in the right place at the right time. We have 9 priority areas that CHN is informed by. So those 9 priority areas are there. I won't go through them too much, but naturally, I think the most important priority areas for this program are the mental health and aged care priority areas. And this is a really essential program, I think, to be looking at how we can be working across those areas too. Okay, so I will just start by giving a little bit of an overview of the improved access to psychological services in RACH's program, and just a bit of an explanation of, why we're doing this RFP today and what the objectives of the program really are. So this RFP is really seeking proposals for providing those psychological services within the RACHs. So what that means really is psychological services can refer to various types of support and therapeutic approaches that are tailored to be meeting the needs of residents who are currently living within RACHs. The idea and rationale behind this initiative is to be addressing a gap in access to mental health care for aged care residents. And you may have already heard about this initiative. It was released as a pilot initiative across Australia led by PHNs, I believe back in 2019, and it is now been sort of embedded longer term through PHNs in every region across Australia. So the key objectives of this initiative, we've split them into 4 areas here, and this information is also in the RFP document if you would like to refer to that to familiarise yourself further. Essentially, the first 2 objectives here are really looking at the impacts that we hope this initiative will have on the residents of residential aged care homes. So really it's looking at ensuring that these residents can experience improved wellbeing, strengthened coping skills, stress management techniques, increased enjoyment in life, increased confidence, and increased connection with others, as well as experiencing less stigma and more willingness to discuss their emotions and be more open about their mental health and well-being. Greater participation in the sort of life and activities within residential aged care homes, fewer challenging behaviours, and a stronger ability to be resolving issues and concerns. Another important part of this initiative is capacity building. So noting that this is an initiative where we are working very closely with residential aged care homes and staff within those residential aged care homes, it's really important that those homes are able to really build their capacity in working with older people who are experiencing mental ill health. And that can include improving their ability to recognise early signs and symptoms of mental ill health so that they can support their residents to be able to access the right support for their needs, as well as understanding referral pathways and building their skills in providing support as well. And then the next sort of key objective of this program is really surrounded around referrals and ensuring that whether they are referrals into this program or into other services, that GPs and other referrers are supported to identify and refer residents of residential aged care homes who might be requiring these interventions to the right place. So this includes enabling efficient use of resources and supporting tailored referrals that best meet the individual needs and circumstances of the people for whom they are making the referral. So this is just a bit of an overview about what is in scope and what is out of scope of this particular program. So services can be delivered, services should be delivered where the client resides. So they should be delivered in one of the 27 residential aged care homes in the ACT. And to be clear, when we say one of, this is referring to at a time, this is, we would encourage services to be delivered across as many of the residential aged care homes as possible through that connection. But where we were talking about this is that they do need to be delivered within those homes. Services should be evidence-based and evidence-informed short-term therapies that are delivered by mental health professionals or other trained service providers. They should be person-centred, they should be equitable, and they should efficiently provide services to ensure optimal access. And also in scope is adjusting and tailoring therapeutic methods to be meeting the needs of individual RACH residents. So by this we mean the needs of people living within RACHs may vary depending on some of their sort of circumstances and their particular needs. And certainly we would encourage service providers to be thinking about how these can be adapted to make sure that when we are developing and delivering therapeutic services, that the approach to them is adjusted to make sure that they are meeting those circumstances and needs. Out of scope for the program, one important part of it is implementation processes that will result in additional demands on RACH staff that is beyond their responsibilities. So while it is very important to be collaborating and partnering with RACH staff and supporting them in terms of capacity building, an important part of the implementation of this program is that the sort of boundaries of the role and the ability of the staff within RACHs to participate in this program can be limited, and so that needs to be taken into consideration in the design of the program. Also out of scope includes services for family members, carers, or older people who are not residents. Services that would usually be provided by the RACH staff or volunteers. This might include the sort of more non-therapeutic social and recreational services. And also transportation to another service or services delivered outside of the RACH. Okay, so here we've just got, I guess, some key success criteria. So really what a good service for psychological services in residential aged care homes will look like. So some of the really important sort of signs of success for this service and enablers for a good service include strong partnership in the designing and delivering of services, innovative collaboration pathways that are established with the staff of residential aged care homes, engagement and capacity building in RACHs, multiple referral pathways. So referrals into the service can come from RACH staff, and quite often they do, but they can also be via self-referral, through families and friends, through GPs, through ACAT, or even community visitors in residential aged care homes. Clear communication pathways is certainly an enabler for this program. Enabling timely assessments at the point of referral is also very key. Strong understanding of the older person's unique mental health needs and provision of independent, holistic and tailored support. So this is really leveraging off that earlier point that therapeutic approaches may need to be adapted to make sure that they're best meeting the need of the older person. And finally, a commitment to service monitoring and continuous improvement. Okay, so here we're sort of getting more into the nitty-gritty in terms of responding to this particular RFP. So we have 7 key assessment criteria for this RFP. I won't go through them in a considerable amount of detail. They are all in the RFP document with a lot more information than here. So I would encourage you to read that in more detail before responding to this request for proposal. But the 7 criteria that we're looking at is firstly a local service model. So just an overview of how you would propose or intend to be delivering the improved access to psychological services program. Responsive practice, which really means thinking about how the service will be strengths-based, inclusive, culturally safe, person-centred and trauma-informed. Engagement and participation. So this is really looking at how the service will collaborate and integrate with key stakeholders, including the RACHs, and how the service will be engaging residents and their families and carers. Experience and capacity. So this is really an opportunity for applicants to describe their current and previous experiences working with older people with mild to moderate mental illness. Governance structures and systems. So here we're looking just to understand your organisation's existing governance structures and processes, and also to understand how these governance processes will support the service to be delivering high quality care. An implementation plan. Here we are hoping to understand your processes for implementing the service and the stages at which you will be taking to reach service establishment, which will include stakeholder engagement and partnership development, service delivery, clinical governance, and quality assurance and scale-up mechanisms. And the last area is the budget and value for money. So here we're just looking for a budget demonstrating the costing and pricing within the budget of this particular tender, and also understanding how this service is demonstrating value for money. This is a bit of an intense slide, so I won't go through it in too much. Again, all of this information is in the RFP, but these are just some valuable extra reading that we would recommend as part of your submission for this particular tender. So this includes the national guidance for the program and also a national evaluation that has been conducted for the program, which both are very useful documents for understanding what the overarching requirements are for the program and really what the success factors have been in other regions. We've also got a couple of documents referring to stepped care in the mental health space. So this includes the PHN stepped care mental health guidance and the initial assessment and referral, the IAR decision support tool guidance, and including a sort of side note for that, which is an adaptation to the IAR guidance for older adults. So these documents are really designed to be supporting your understanding of stepped care and how that can be applied in a residential aged care home. And then we also have a couple of other documents providing information about the sort of older person's mental health services, and including some information that has been supported by New South Wales government there as well. Okay, so just as a sort of quick timeline, we do have a relatively short turnaround for this particular tender. We will be accepting questions via our tenders inbox. The email address for that will be on the next page. We'll be accepting questions until 4 p.m. rather, next Wednesday, the 14th of August. And then the submissions will be closing at close of business the following week, so Thursday, the 22nd of August. There are a few more sort of key dates in the RFP as well, so I would encourage you to look at those to make sure that they are all front of mind. Okay, and that is pretty much everything in terms of the overview of the program and the RFP. So we have a bit of time for questions now. As mentioned before, please make sure that you are putting your questions in the question and answer section. Please try not to pop them in the webinar chat. It's just a lot harder for us to keep track of them there. So please make sure they go in the Q&A section there. I will pause for a moment now and we'll see if we get any questions coming through. Thank you. Okay, we've had a couple of questions come through that we'll start to answer. So we have one question about the national pilot program that I mentioned previously that started in 2019, and whether there was a pilot conducted in the ACT and if there are any details about the pilot. So there was a pilot conducted in ACT that was also funded by CHN as part of this pilot program. This pilot, I think, started right at the beginning of 2020 and was rolled out as part of the Next Step program that CHN currently funds. So this was referred to as the Next Step in Residential Aged Care program at the time. So this program notably did start in 2020, and we of course entered into quite a challenging period of time with COVID and also with an Aged Care Royal Commission happening at the same time, which did lead to a degree of complexity, I would say, in the program and in the rollout, which did happen nationally and you can read more about some of the challenges and the influences that had on the pilot in the evaluation document as well. In terms of information about that pilot, so the pilot was providing the Next Step low intensity and Next Step high intensity programs through residential aged care, although the high intensity program through Next Step did not have a significant amount of uptake due to some of those influences, including COVID and the impact that COVID did have as well on residential aged care homes. Through that pilot, I think 4 to 5 residential aged care homes were engaged and were involved in the pilot. And the Next Step coaches, which aligns with the Next Step model, were accessing or being involved in the residential aged care homes to be providing that support. So within that support, it was based on the Next Step CBT-based model there as well. Like I said, I think there was also a telehealth program that was used to support the uptake of that given COVID as well. But the uptake was quite limited due to some of those impacts. There hasn't been a local evaluation of that pilot as the national evaluation was happening, and so there was the data was being collected for that purpose. So the national evaluation is really the most useful document to be receiving more information about some of the challenges and some of the successes that were experienced by our program both locally and nationally. But we don't have a whole lot of local information about it beyond what I have just shared. We will endeavour to see if there is more information beyond what I'm aware of and check with the project manager as well. And if there is more information, we will take that part of it on notice and make sure that we put that in the question and answer document that will be provided on the CHN tenders page. There is a related question about if the service is currently being delivered in the ACT, and if so, if we can provide numbers of the residential aged care homes that have engaged with it to date. So it is not currently being delivered. It has been a bit on hold due to some of those challenges and also some changes in the funding nationally as well. But when it was being delivered, as mentioned, there were, I think, 4 or 5 RACHs that were engaged at the time. And there is also a question about whether there are any expectations of how many residential aged care homes should be engaged across the period of the service. Ideally, if the service could be rolled out in all 27 of the residential aged care homes in the ACT, that'd be fantastic. There is no minimum number. The goal really is more about the service itself and the staff who are providing the psychological services themselves, and building that relationship with as many residential aged care homes as well, to ensure that as many aged care residents as possible in the ACT at least have access to and availability to access the service. There are no other questions at the moment, so we might just give it another couple of minutes to see if there are any more coming through. Just a question noting the timelines for the service. You will note on the RFP that the service is due to commence on Monday, 1st of November. And the question is whether that is commencement of engagement with residential aged care homes or commencement of the service delivery to the residents. The ideal situation is that it is commencement of service delivery to the residents. However, we do know that this is a pretty tight time frame. It is a pretty tight time frame overall with this project, and we are certainly narrowing those quite a lot. We do understand that, and we also do understand that the successful provider for this initiative is not the only one not the only stakeholder in terms of building that relationship with the residential aged care homes. So we are very happy to discuss this with the successful provider and ensure that we can navigate these timeframes to the best of each of our ability. There is also certainly a role for the PHN to be doing a lot of the engagement of the residential aged care home support as well. The relationship between the provider and the residential aged care homes is essential to the delivery of the service, but CHN are also very happy to support with that to help build those relationships and navigate some of those timeframes as well. So while we, I think at the moment we have the establishment for the service in October, where we are really hoping to be working through building some of those relationships with the services to commence in November. We are, like I said, happy to sort of negotiate that and discuss what might be the most appropriate and feasible timeframe with the right provider. I'll just give a couple more minutes and we'll see how we go for more questions. Okay, it looks like that might be everything for the questions today. So we might finish off there. Thank you very much, everyone, for your attendance today. As mentioned, we have period of questions is open until next Wednesday, the 14th of August. So if you do have any more questions after today, please feel free to send them through to tenders@chnact.org.au. This session has been recorded and it will also be updated on the CHN tenders page in the next couple of days, so that you can refer back to this, and also so that anyone who wasn't able to attend today is able to view this briefing session. We'll also be updating a question and answer document over the next couple of days with all of the questions from today, as well as any additional questions that might have come through via email. So keep an eye on the tenders page for that one as well. Otherwise, thank you very much for your attendance today, and we look forward to seeing the proposals we receive. Thanks, everyone.